bring it back to positivity. So if these failures could occur, not that they will occur, what should you do? That is why I mentioned earlier in my video that psychological readiness is important. You need to plan for the worst but hope for the best. So if you do not respond to the injections, if they don't get eggs from the egg collection, if in those two cases, it means probably the egg quality is not good, because sometimes the test we do is not specific. So it means we need to pause the procedure and start again with a higher dose of injections, or you can convert the cycle to a donor egg cycle. In one video, I'll explain what donor egg means and third-party IVF is. Some people do respond in their second try with increased dose and of injections and some supplements and some, lifestyle modifications. So if you have a poor viral response, it will be due to 40, 45-year-old. Once you're getting older than that for women, you might not respond well. And as I said, we increase the dose of injection in your next cycle, or you could opt for donor egg. That could increase your success rate, and it has helped couples. In a case whereby no fertilization occurs, sadly, we have to stop there and restart the cycle all over again. The common reason for poor fertilization is the sperm quality. So if we've tried our best to give you supplements before starting IVF to boost the quality of the sperm, it may not still fertilize the egg. So what do? We repeat the procedure. We do apply some technology on the sperm, like sperm sorting, or we do what they call sperm sorting pixie, or last resort is donor sperm. So because you don't want the same thing to happen again. So that is the options for that. In the case whereby the embryos are formed, but they don't grow again, and we don't have babies to transfer on the 5th day, it could be a cause commonly from the sperm too, because if the sperm is not quality enough, it might not allow the baby to survive till 9 months. So if this occurs, we have to review the sperm again, check the DNA of the sperm. I know you have a question. You say, why didn't we check all this even before we start? Well, remember in my second video, I talked about choosing the best option, because the sperm, the egg, the womb play a very huge role in the success of IVF. But if the sperm is this, and we've tried every means and to make it better, and it's not getting better, but we still need to go ahead if you insist, it can still work, but you have to be aware that it might not work if the sperm is poor and you have a 10% chance of it being able to fertilize an egg. You could fall in that 10% and you could be lucky, but if you don't fall in that 10%, what do we do? So is that we cancel the cycle and restart again, do some technology on the sperm or donor sperm. I must say, choosing the best option for IVF would shorten the duration of couples doing IVF over and over again. I hope you understand what I'm saying. So if the womb is not okay, what is the best option? And do you accept the best option? If the egg is not optimal, especially for ladies who have endometriosis, PCOS, or above 37, what options do you have? Lifestyle modifications can help. Burning fats, eating healthy, using supplements can help. Donor egg is also an option. So I advise that before the IVF process starts, during the review of your results, your sperm, your egg, your womb, discuss very well with your doctor to know your chances. Even if these parameters are not okay, it still doesn't mean you will not get pregnant. People get pregnant with poor results, but you have to be prepared for whatever outcome that comes. So these are the failures that can occur. If you feel you're not ready to enter IVF, please do not start to do it, because if this kind of disappointments arise, it could be so unbearable to couples, and it will be as if we never told you about it. So that's why I'm making this video, for you to understand that do not be afraid of the failures. Go ahead and choose the best option. I'm not forcing you to choose the best option. When I mean best option, like If for this case, the best option is to wait for 3 months before you do IVF. Wait for 3 months to do IVF. Improve your sperm quality. If the best option is surrogacy, well, let it be. If your best option is donor sperm or donor egg, consider the options and let it be. Speak to your doctor, agree, and hope for the best. Prepare for the worst. But remember that taking that step for IVF was never a mistake, whether it comes out positive or negative. So I wish you the best in this IVF journey. So I believe I've tried to explain all you need to know about IVF. If you have questions, make sure you ask your doctor, your nurse, your provider. Also, we have counselors who can encourage you along the IVF journey because the IVF journey is kind of long and therefore you need to have people you can talk to, people that can encourage you and also to, at the end of the day, making you have a safe trip. So remember that all is well. You will be fine.